Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today we are going to see what exactly should a patient do on the day of her oocyte retrieval surgery. So it is very important that oocyte retrieval or ovum pickup is the surgery which is very important in a IVF cycle. This is the surgery in which under full general anesthesia through your vagina, the IVF consultant is going to retrieve or take out all the eggs, and then we are going to screen the eggs for M2 oocytes, that is the mature eggs, and make babies using the husband's sperm with M2 oocytes of the mother. Now, during this ovum pickup surgery, there are certain do's and don'ts which have to be followed for a better recovery post-operatively. So first and foremost, you should not eat anything, absolutely anything, from the night before the ovum pickup surgery. So generally, we operate in the mornings around 7:38 so that the patient doesn't have to fast longer. So the day before, we generally tell the patient that after 10 o'clock, she should not have any fluids or food, and no food, no water. In the morning, she can get up, brush her teeth, have a good warm water bath, remove each and every ornament on the body, nail paints, lipsticks, liners, no cosmetics, no perfumes are allowed in the IVF labs as it interacts and increases the VOC, thereby reducing your success rates while making the embryo. Once the patient has had a clean bath, she's supposed to get admitted in the morning. Her private parts have to be shaved really clean because we are going to use certain antiseptics to cleanse the area before we start the surgery. These things are absolutely very important. They might sound very small, but each and everything really matters whenever we consider success rates in test tube baby technologies. Whenever the patient gets admitted, to get a very good intraoperative care, we generally start 1 point of saline to the patient. The necessary antibiotic has to be given an hour before the patient is induced for surgery. To prevent vomiting, injection ondansetron or Ondem is given, and to reduce the acidity post-operatively, generally a PAN 40 IV injection is administered. Once the patient is all set and ready, she is taken for general anesthesia in the IVF operation theatre. It is hardly a half an hour to 1 hour surgery depending on the number of your follicles. Immediately 3 hours after your surgery, you're allowed to drink water. If you tolerate the water well without any vomiting, we can give you a full hearty meal on the day of the surgery within 3 hours, and the patient is generally discharged after 8 hours of the surgery. So if a patient follows all these instructions really well, she will have a very smooth surgery and a very good and fast post-operative recovery. Generally, our patients immediately start working the next day after their oocyte retrieval, and this is the beauty of these daycare surgeries. Thank you.